I believe we're at 48 as of right now, confirmed. The right now they're working on updating so I'm getting the confirmation on recovered to see if we're still at 23 or if it's changed for today. So I can give you that here in just a second.
Okay, thank you, Brandy. Russell, you want to go over the numbers for Medical Center Hospital?
Sure will. Good afternoon, everybody. Currently at Medical Center, 27 positive, 27. 3 of those are on CCU, and 2 of those are on 7 Central. And I'm assuming the 3 on CCU are probably still our ventilator patients that we had yesterday. On our testing side, 223 negatives with 40 pending. So we have 40 more tests pending currently right now. We have 7 persons under suspects pending results that are in the house today. And then 3 of those are on CCU as well, and 4 on 7 Central. So our number seems to be holding pretty steady there. The under suspect has gone down, so that's good news. We like that. But 23 right now on the vent and 2 on 7 Central. So that seems to be holding pretty steady.
All right, Stacy, do you want to go over the numbers for Ormc, and then we can speak with a few things with the doctors real quick?
Yes, sir. Thank you. For ODESSA Regional, currently we have 126 tests that have been completed, 9 of those positive, 109 negative, with 8 pending. In terms of what's in the hospital, we have 3 patients, 2 are under investigation, and 1 of those is confirmed. That's all I have.
All right, thank you, Stacy. And I want to start off with a question that I know we've been getting a lot of media requests for, as well as on Facebook. And I'll just start with you, Dr. Davenport, who's interim CMO here at Medical Center. Just lots of questions about this plasma from recovered patients. Is there any updates on that as far as plasma being obtained locally? Is it seem to be working, or we just still don't have enough evidence yet?
So the easiest way to say this is Part C. We still don't have enough evidence yet. It's still in its infancy with regards to programs, utilization, being able to obtain the plasma. A lot of that does have to do with the limited amount of testing that we have, the variability with regards to patients that are receiving it, the critical nature of those individuals, and the unknown recovery that those individuals are going to have once they receive it. So it's an investigational medication plasma, if you will, and we are utilizing it as really a final use to try and help these critical patients recover from the disease.
All right, thank you, Dr. Davenport. Dr. Saravanan, did you want to add anything as well?
Sure, Trevor. The thing that I wanted to share was on the website on the FDA, which I think I have brought up before. If you look under donor eligibility, we're talking about this SARS-CoV neutralizing antibody titers, and they're looking for a titer of 1:60, 1:160. That titer means an antibody test. That's the IgG that I've brought up before. That test is not currently available locally yet. I was just on the phone with the LabCorp medical director for our region, and they said they're close to working on it. They may have it ready by end of next week, but they're not sure yet. They asked me to reach out to private labs, but I'm not sure if our blood banks will accept a regular private labs antibody test. So I'll reach out to them, see if that's a possibility. And now that we have several recovered people, we'd love to be able to collect that plasma locally and be able to use it locally as well.
All right, thank you, Dr. Saravanan. Kristen, I think you wanted to add something as well as far as trying to get some of that plasma locally.
Yes, so in order to get some of that, we've already started a process here at Medical Center. Any of our patients that have tested within our hospital system and they've recovered, we are calling those patients, as we talked yesterday, on day 3, 7, and 10 anyway. So we are going to start calling them and having those conversations to kind of get the ball rolling to see if there's an interest. And then by day 14, we will be having the conversation to say, if you would like to be a donor and they do say yes, we've established a process to get them retested, to get the negative results, and then turn around and work with Vitalant to get those people through this system to donate the plasma.
Awesome. Well, thank you so much for sharing that, Kristen. I know that's good news for the community. So these hospitals don't always have to travel out of town to possibly get this plasma. Just saw Mayor Turner. I'm sorry I didn't give you a chance to say a few words. Mayor Turner, would you like to say something before we get to the media for questions?
Been working with Mayor Payton to discuss once we get to the point that we can start reopening businesses. We're going to be working with the medical community to decide the best course going forward. We are going to have a conference call with the governor, all the mayors in Texas. So I'm assuming that he's probably going to talk about that on Friday. So we look forward to that.
All right, thank you very much, Mayor. Some good news there. All right, let's go ahead. I'm sorry, go ahead, Brandy.
Dale would like to say something before we open up for questions.
Okay, perfect.
Thanks, everyone. I just want to make an announcement that we have had another exposure here at the EOC. And just like the last time, we went ahead and went virtual again. We have a few people here at the EOC, but for the most part, it's just a skeleton crew. And we'll be working virtually until we get some test results. We tested several people here at the EOC today, and we'll be testing a few more tomorrow. When we get those test results back, then we'll hopefully open back up in a limited fashion. We're going virtually anyway, so that's the best way to go.
All right, thank you for sharing that, Dale. Let's go ahead and get to media questions now. Looks like first up on the list, we've got Scott from CBS 7. Scott?
Thank you, Trevor. Yesterday, in your Facebook Live, Mr. Mayor, you mentioned that the EOC is keeping track of cases on a map. There are our assistant news director was able to put together some props. My Dale Carnegie teacher always told me to use props. San Antonio, Corpus Christi, Travis County, they're all doing maps by zip code and letting people know where the people are who are positive. If we're keeping track of that, how do we as the media get a hold of that information?
Go ahead, Bill.
I'll answer that. We're working on getting that for you. What we've got to do, our map actually has addresses on it, and we don't want to violate HIPAA regulations. So we're getting that for you as we speak.